This oral syrup antitussive medication is used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses, such as sinusitis and bronchitis. Dextromethorphan, a cough suppressant, works by reducing the urge to cough by affecting a certain part of the brain known as the cough center. Decongestants help to relieve a stuffy nose, while antihistamines help to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old. It's crucial not to use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years old. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, it's important to carefully follow all dosage directions. It's crucial not to use this product to make a child sleepy, and to avoid giving other cough and cold medication that might contain the same or similar ingredients. It's important to consult with a doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Westussin DM1 Mg-5 Mg-10 Mg/5 ml oral syrup antitussives, make sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. You can take this medication by mouth with or without food, along with a full glass of water. If you experience stomach upset, you may take this medication with food or milk. If you are using the liquid form, make sure to use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon to measure. If you are taking the extended-release capsules, swallow them whole and do not crush or chew them. The dosage of this medication is based on your age, medical condition and response to therapy. If you are taking this medication for allergy or hay fever symptoms, take it regularly in order to get the most benefit from it. It is important to use this medication properly and not to increase your dose, take it more often, or use it for a longer time than directed. If your condition lasts or gets worse, make sure to inform your doctor. As with any medication, Westussin DM oral syrup may cause some side effects. These can include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. To relieve dry mouth, you can try sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to stay hydrated while taking this medication, unless otherwise directed by your doctor, as it can dry up and thicken mucus in the lungs. To reduce the risk of dizziness and lightheadedness, it's best to get up slowly when rising from a sitting or lying position. If your doctor has prescribed this medication, it's because they believe the benefits outweigh the potential side effects. However, it's important to be aware of any serious side effects that may occur, such as mental/mood changes, ringing in the ears, shaking, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizure. In the rare event of a serious allergic reaction, seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed here, it's best to contact your doctor or pharmacist for guidance. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, it is important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other problems. It is also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. This medication may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana, cannabis, can intensify these effects. It is important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended, and it is important to talk to your doctor if you are using marijuana, cannabis. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine, it is important to consult your doctor or pharmacist before using this medicine, as it may contain aspartame. Liquid preparations of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. It is important to ask your doctor or pharmacist about the safe use of this product. Before undergoing surgery, it is important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults and children may be more sensitive to the side effects of this drug, and it is important to monitor for dizziness, drowsiness, mental/mood changes, constipation, fast heartbeat, trouble urinating, or blood pressure changes. In young children, this medication may cause agitation/excitement instead of drowsiness. During pregnancy, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. If you are breastfeeding, it is important to consult your doctor before using this medication. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It's also important to be cautious when taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, or drugs for sleep or anxiety. Always check the labels on your medicines and talk to your pharmacist about using them safely. Additionally, be aware that this medication may interfere with certain medical or lab tests, so make sure to inform lab personnel and all your doctors that you are using this drug. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, it's crucial to call for emergency help right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Symptoms of overdose may include agitation, confusion, flushing, hallucinations, large pupils, muscle twitching, seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. If your doctor has recommended Westussin DM oral syrup antitussives, it's important to follow the dosage instructions and not share the medication with others. It's also important to attend all medical and lab appointments as advised by your doctor. If you forget to take this medication at your regular time, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your usual time. Don't take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule. Make sure to store this medication at room temperature, away from light and moisture, but not in the bathroom. Don't freeze the liquid form of this medication and always keep it out of reach of children and pets. When you no longer need this medication or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.